1. Xanax. Xanax is prescribed for anxiety and panic disorders. It works by enhancing GABA, a neurotransmitter that slows brain activity. Within minutes, anxiety dissolves, your muscles relax, worry evaporates. Abuse happens when people take higher doses than prescribed, or use it recreationally for sedation. Xanax acts fast, producing a strong reinforcing effect. It causes drowsiness, impaired judgment, slowed reactions, and memory loss. High doses lead to blackouts where you do dangerous things without recall. When combined with opioids or alcohol, respiratory depression and fatal overdose risk increases sharply. Dependence develops fast with regular use. Withdrawal includes rebound anxiety, insomnia, tremors, hallucinations, and seizures. Unsupervised cessation can be deadly. Adderall. Adderall is prescribed for ADHD and narcolepsy. It contains mixed amphetamine salts that increase dopamine and norepinephrine in your brain, enhancing alertness, focus, and impulse control. Abuse occurs when people take it in higher doses or without a prescription to increase concentration, energy, or suppress appetite. Students and professionals chase productivity. The drug produces confidence, motivation, and euphoria. Adderall increases heart rate, blood pressure, and body temperature. High doses strain your cardiovascular system and can cause irregular heartbeat, chest pain, heart attack, or stroke. Psychological effects include anxiety, irritability, paranoia, and insomnia. Tolerance develops with repeated use. Withdrawal includes extreme fatigue, depression, slowed thinking, and strong cravings. Chronic misuse causes cardiovascular damage and stimulant-induced psychosis. Vicodin. Vicodin combines hydrocodone, an opioid, with acetaminophen. Hydrocodone binds to opioid receptors in your brain to reduce pain. Acetaminophen increases pain relief through a separate pathway. It's intended for short-term treatment of moderate pain. Abuse occurs when taken in higher doses, more frequently, or longer than prescribed. Hydrocodone produces sedation, relaxation, and euphoria. Tolerance develops quickly. Vicodin suppresses your central nervous system. It slows breathing and reduces alertness. When combined with alcohol, benzodiazepines, or other opioids, respiratory depression becomes significantly more dangerous. The acetaminophen component introduces a separate risk. High or repeated doses cause severe liver damage even before opioid overdose symptoms appear. Many acute liver failure cases link directly back to excessive acetaminophen from Vicodin. OxyContin. OxyContin is prescribed for moderate to severe chronic pain. It's an extended-release tablet designed to release oxycodone slowly over many hours. It binds to opioid receptors, reducing pain while producing relaxation and euphoria. Abuse occurs when tablets are crushed, chewed, or dissolved to bypass the extended-release mechanism. This causes a large amount of oxycodone to enter your bloodstream at once, producing an intense high. This overwhelms your brain's reward system. OxyContin depresses your central nervous system. It slows breathing, lowers heart rate, and reduces oxygen levels. At high doses or combined with alcohol or benzodiazepines, breathing can slow to respiratory failure. Long-term use alters brain chemistry. Your brain reduces natural endorphin production, making you dependent just to feel normal. Withdrawal includes severe muscle pain, vomiting, diarrhea, anxiety, insomnia, and intense cravings. Percocet. Percocet combines oxycodone, a potent opioid, with acetaminophen. Oxycodone reduces pain by activating opioid receptors, while acetaminophen enhances pain relief. It's commonly prescribed for acute pain following surgery or injury. Abuse involves taking larger doses than prescribed or using the drug for non-medical reasons. Oxycodone produces euphoria and emotional numbing. As tolerance develops, users escalate doses to maintain effects. Percocet significantly depresses your central nervous system. It slows breathing, lowers blood pressure, and impairs coordination and judgment. Overdose risk increases sharply when combined with alcohol or sedatives. The acetaminophen component creates additional danger. High doses damage liver cells and can cause irreversible liver failure. This damage may occur silently before overdose symptoms become obvious. Long-term use alters brain chemistry. Withdrawal includes intense physical discomfort, gastrointestinal distress, anxiety, insomnia, and strong drug cravings. Ambien. Ambien is prescribed for short-term treatment of insomnia. It works by binding to GABA receptors in your brain. GABA slows brain activity, allowing your body to transition into sleep. Although not chemically a benzodiazepine, it produces similar sedative effects. Abuse occurs when Ambien is taken in higher doses than prescribed, used recreationally, or combined with other depressants. Some users seek hallucinatory effects. One of Ambien's most dangerous properties is its ability to disrupt memory formation, leading to partial or complete amnesia. It causes dizziness, confusion, impaired coordination, and slowed reaction time. At higher doses, it triggers complex behaviors like sleepwalking, sleep eating, or sleep driving without awareness or memory. Combining Ambien with alcohol, opioids, or benzodiazepines significantly increases respiratory depression and overdose risk. Ritalin. Ritalin, known generically as methylphenidate, is prescribed for ADHD. It increases dopamine and norepinephrine in your brain, neurotransmitters involved in attention, motivation, and impulse control. It helps improve focus, reduce impulsive behavior, and increase mental alertness. Abuse occurs when taken in higher doses than prescribed, used without a prescription, or altered by crushing and snorting tablets. Rapid delivery produces sharp dopamine spikes, which intensify stimulation significantly. Ritalin raises heart rate and blood pressure. Common effects include restlessness, anxiety, irritability, and insomnia. At higher doses, your cardiovascular system is strained, increasing risk of hypertension, irregular heart rhythms, and chest pain. Psychological effects include agitation, paranoia, mood swings, and impaired judgment. Withdrawal includes extreme fatigue, depression, slowed thinking, increased appetite, and reduced motivation. Fentanyl. Fentanyl is prescribed for severe pain, often in cancer patients or after major surgery. It's 50 to 100 times more potent than morphine. Very small doses produce powerful effects. Fentanyl binds tightly to opioid receptors in your brain, rapidly reducing pain while causing sedation and euphoria. Abuse occurs when prescription fentanyl patches, lozenges, or injections are used outside medical supervision or in higher doses than intended. The margin between a therapeutic dose and a fatal dose is extremely small. This makes fentanyl one of the most dangerous prescription opioids when misused. It strongly suppresses your central nervous system. It slows breathing, reduces oxygen intake, and can cause loss of consciousness within minutes. Respiratory failure is the primary cause of fentanyl overdose deaths. Combining it with alcohol, benzodiazepines, or other opioids dramatically increases this risk significantly. Valium. Valium is a benzodiazepine prescribed for anxiety disorders, muscle spasms, seizure control, and alcohol withdrawal. It works by increasing the effect of GABA, a neurotransmitter that slows electrical activity in your brain. This produces sedation, muscle relaxation, and reduced anxiety. Abuse occurs when Valium is taken in higher doses or for longer periods than prescribed or without medical supervision. The calming effects create psychological reinforcement. Because Valium has a long half-life, it accumulates in your body, increasing the risk of unintentional overdose. It causes drowsiness, impaired coordination, slowed reaction time, and reduced cognitive function. When combined with alcohol or opioids, respiratory depression becomes significantly more likely and can be fatal. Long-term use leads to tolerance. Physical dependence develops as your brain adapts. Withdrawal can be severe and includes anxiety, insomnia, tremors, confusion, muscle spasms, and seizures. Tramadol. Tramadol is a prescription pain medication with a dual mechanism of action. It binds weakly to opioid receptors in your brain while also inhibiting the reuptake of serotonin and norepinephrine. These neurotransmitters influence mood and pain modulation. Abuse occurs when tramadol is taken in higher doses than prescribed or without medical supervision to produce euphoria or emotional relief. Although perceived as a milder opioid, misuse can still lead to physical dependence and overdose. Users often underestimate its risks. Tramadol depresses your central nervous system, causing sedation and slowed breathing, particularly at high doses or when combined with alcohol, benzodiazepines, or other opioids. A unique danger is its ability to lower the seizure threshold. Seizures can occur even at moderate doses. The risk increases significantly with dose escalation or drug interactions. Withdrawal includes anxiety, sweating, nausea, insomnia, depression, agitation, and in some cases, seizures.